We're joined now again by a familiar guest, Dr. Patrick Nuzzo. Welcome back.
Thank you so much.
Thank you so much for coming back on the show.
I'm happy to be here.
So yesterday was Veterans Day, obviously. The last time you and I talked, we were talking just in general about Naprapathic medicine in New Mexico,
Correct.
how it came about, what your journey has been like, what you offer in terms of services over at your practice and also at the school, of Naprapathic medicine.
Correct.
Well, you mentioned a specific program in general that I think caught our interest, and we wanted to make sure we brought you back on and talked a little bit about, and that was a program working with veterans who are experiencing post-traumatic stress disorder and musculoskeletal pain as a result of that post-traumatic stress disorder.
Correct.
Tell us a little more about when you started working with veterans and noticing that this program could be particularly effective with them.
Well, I actually worked with vets for 30 years in my my private practice. Vets returning from Vietnam had neuromusculoskeletal pains along with PTSD who were not happy with just drug therapy. This particular program started actually in 2013. The 2013 New Mexico legislature, the House of Representatives, presented a memorial that asked to study the effects of naprapathic treatments on combat veterans who were diagnosed with both post-traumatic stress disorder and suffered from neuromusculoskeletal pain because of the post-traumatic stress and because of their service. So we, as a school, Southwest University of Naprapathic Medicine, decided to take this study on. In end of 2013, between September and December, we recruited 10 veterans. Actually, 9 started the program, 7 finished the program, and the idea was to give 10 veterans one treatment a week for 10 weeks, one naprapathic treatment a week for 10 weeks. And our idea was to help treat their pain, their sleeplessness, their insomnia, just the day-to-day wear and tear, headaches, neck aches, back aches.
Yeah, and for those who didn't catch the show last time, tell us again, what do those naprapathic treatments involve exactly?
See, naprapathic and chiropractic are very similar, as I said. The founders were actually together. So the principles, the philosophy of the education is almost identical. What's different about naprapathic and chiropractic is naprapaths, instead of doing high velocity adjustments on the bony structure, they treat the connective tissue that pulls that bony structure out of alignment, okay? And this is where it falls into the vets, because there's 3 types of connective tissue, okay? There's ligaments, which hold bone to bone. There's tendons, which hold muscle to bone. But the most prevalent connective tissue in the body, and the one that's affected most in post-traumatic stress disorder, is called the fascia, or the interstitial tissue, okay? The fascia is the lubricant that runs in between every layer of muscle, that covers every organ, that covers every bone. It's viscous. It's like a net that wraps. So there's a layer of muscle, a layer of fascia, a layer of muscle, a layer of fascia. When the body moves, when the neck turns, when the shoulder moves, the muscle should roll over the fascia because it's a lubricant. In stress, in trauma, okay, in poor posture, the fascia tends to dry out. When the fascia dries out, it turns to glue, and it glues layer to layer of muscle. And then when you move your head or you move your arm, instead of the muscles rolling over, the body pulls the bony structure out of alignment, which creates inflammation, creates pain. These young men and women who've endured combat atrocities and have to be on high alert, 24 hours a day. They're always looking over their shoulder. They're always on high alert. That high alert makes the body tense up, okay? When the body tenses up, that fascia does not get the lubrication. That fascia dries out, okay? So what we do with these veterans is we bring them in for hands-on manual treatments. They're 30 minutes in length. We do a full intake. We do a questionnaire with them, kind of, measuring their sleeplessness, their pain levels, their range of motion, an array of different tests. And every time they come in, we continue to take those tests and see what kind of results that we have with the veterans. Every one of them reduced pain, better sleeping, reduced medication that we treated in degrees from 10% to 90% better, okay, out of these 7 patients, which they're in the preliminary study. So now we've gone back to the legislature, the Legislative Veterans and Military Interim Committee, and ask them, and that was why you brought me last time because of the newspaper article.
Sure.
We're going back to the legislature asking the VA to fund this study, okay, so we can do 50 vets over the next year period, 10 weeks, 10 treatments, and study this and get the results back to the VA and show how much results this can help these guys
I see.
without taking medication, without, doing the normal things that they're doing. We'd like to see the VA look more at complementary alternative medicine like naprapathic, like acupuncture, like chiropractic, and give the veterans the ability to have these benefits covered for them.
Sure.
So that's really why we're, doing this. The other things that we're trying to do with our school is our school has been approved for VA benefits as far as education. So a vet can come into our school,
Got
they
it.
can use their VA benefits, they can come and get the education, and our hope is to get them back out into the system, treat other vets without drugs. So we can educate them, give them a new career, a great career, use their VA benefits to do it, and then go back out there and, help their brothers and sisters who've, had these same, maladies happen to them.
Sure.
And as a matter of fact, if you don't mind me telling you,
Not at all.
on the 22nd of November, which is a week from this coming Saturday, we'll be doing an open house over at SUNM, and we're going to have it for prospective students, and we'd really like to invite veterans to come and see what your educational options are in healthcare, and maybe find a new career out of this
Maybe so.
as we deal with your pain alternatively.
Absolutely, absolutely. And so 10 veterans through this initial sort of pilot
Correct.
program,
Correct.
but looking to expand that to 50.
To 50. And again, we're asking for $90,000 from the legislature for this coming session. And this coming Monday, I don't know if I mentioned this, I go back in front of the legislative committee here in Santa Fe, and this is the day they decide on what bills they're going to take to the legislature
Yes, sir.
to introduce and try to support. So our hope is, and I feel pretty good that we're going to get this bill taken into the legislature at least, and then we'll be able to go through the committees and go through the proper channels there at the legislature and get the $90,000 that we're seeking to do these 50 vets. And really the biggest expense of this whole $90,000 is going to be to compile the
The
information.
statistical work.
It's going to be to compile the information and get the information back to a place where the VA can decipher it and make a decision on, possibly giving, vouchers to these veterans.
Sure.
Because with this new funding that has happened over the last couple of months for the VA, with everything that happened with, the long waits and such, they're coming and letting veterans use doctors outside of the Veterans Administration. So there isn't the long wait lists, and
Perhaps
they're
a
going to be
silver
offering.
lining to come out of that
Exactly.
might be
I mean,
more veterans taking advantage of alternative medicine.
hopefully. So that's kind of our focus and our push and what we're trying to do. And if anybody wants to look at the website, SUNM, it's sunmedu.com.
Got it.
Yeah, sunmedu.com.
Got it. Okay.
And,
And they can get in touch with you on the phone as well.
On the
What's number?
phone, the phone number at the school is 467-8777.
Got it. So you're going back to the committee next week. You've got
Monday.
the open house on the 22nd. Good luck at the legislature.
Thank you so much.
Come back and let us know how that goes.
I will do it.
When do you think we'll hear on the final results if the study is approved? Knock on
Well,
wood.
the study is approved. The funding starts July 1st of 2015.
Okay.
So if we know we get the study approved, we'll line everything up so on July 1st we could start treating the vets, and we could probably get those 50 vets through by the end of 2015.
Perfect.
So that's
Great.
what our hope is.
Well, thanks again for coming
you
by.
so
Thanks
much.
for the
I
good work in
appreciate
the
it.
community and the work you're doing to help
All right.
veterans. We appreciate it,
All
and
right.
I know they do too.